Hello everyone. In this video, I'm going to show you how a microdont would appear on a cone beam CT. This is an incidental finding and also considered as a normal anatomic variation. As you can see from the CBCT scan, there are several edentulous sites that have already been prepared or treatment planned for dental implants. And as I was evaluating the patient's upper and lower arch, there was a microdont that I like to show with everyone. The tooth that I wanted to show today is tooth number 1. I'm going to hide this implant, virtual implants for now. This is tooth number 1 and 2, and obviously number 3 is missing. Just from this 3D rendering, you can see the size discrepancy between 1 and 2. Compare that to the opposing teeth. This is number 31 and this is 32. So both of these being third molars, you can see that the mandibular third molar's size is about the same as the second molar, or maybe slightly smaller. I'm going to modify the rendering so that perhaps we can see the teeth a little better. Whereas if we compare not only the size of the crown but overall the dimension and thickness of the roots, we see that it's significantly less than the adjacent tooth number 2. And let's see how that appears on cone beam CT. So right here, I want you to pay close attention to this area. So here we're at the level of the crown. If you're not sure where that axial plane is, let me see if I can turn the axial plane on. So that's the plane that we're looking at this point. So this is the axial view of number 2 and this is number 1. So compare the size of that crown to this one and how small number 1 is compared to number 2. Number 2 bifurcates into 3 roots, and while number 1 maintains a mostly conical shape of the root, it does slightly bifurcate into a mesial and a distal root. I would like to see that or show you from the sagittal view as well. So there's microdont and a normally sized tooth number 2. Let me see if I can show the occlusal view. There you go. So there we can see the occlusal plane or occlusal view of tooth number 1 and tooth number 2, and you can see how much smaller number 1 is. So again, incidental finding. That would be nice to be able to show with all of you. Here's the last coronal view of number 1, and here's let me see if I can turn this around a little bit. So here's number 2, distal buccal root and a palatal root. Once again, if I go back distally, that's number 1 and number 2. Thank you very much, and I'll see you in the next video. Take care.